Like and subscribe and leave a comment. Thanks for watching. There you go. Yeah. Yeah.
Worse and worse. Past the years and worse.
Right, it just grows.
Yes.
I know.
I call them the little monsters.
Little monsters, I like it. When's your lower back pain the worst? Morning, evening?
All the time, because I was thinking, because I have an issue when if I clean or I go down,
Okay.
I try to put in my position again, and I feel like
It's very tight, very tight.
it's more than tight.
Unstable.
I'm not able. Sometimes I'm not able to
Come back up.
come back up, and
Okay.
it's like
It's
in
stuck.
that position, exactly stuck.
It's stuck.
And if I do hard work like a cleaning
Yeah.
or go down too much for do something,
Yes.
I need to. I feel like a cold thing, like my back freeze, and I said,
Okay.
"Oh my gosh!" I
Yeah.
stayed in that position for a long time,
Gotcha.
and I was thinking, and I remember that in my 16 years old, I felt, and I was walking, and I felt, I touched water in the floor,
Yes.
and I fell in this position,
Yes.
and I fell
Under your bottom.
in my bottom,
Mhm.
and I remember taking like more than 20 minutes to try to get up.
Right.
And but I forget that thing, you know.
Yes.
I was thinking, because the person that gave me the massage asked me,
Yeah.
and say that is not normal.
Yeah.
You have something over there,
Yeah.
and I have a lot of pain
Okay.
in this area.
So our spine has a lot of feeling on the back. So this is our here's us, and this is the front. Here's the back side. These are the little bumps that you feel in your back. So the structures on the front have very little feeling, and the structures on the back, these are the joints where the little handshake. See how these sort of slide together? And then when you're bending forward, watch what happens to the size of that hole. See how it gets bigger, right? And that's when you're bending forward. Two things are happening. The nerve's not going to get pinched, but the joint separates, and so the joint is separating, and now there's ligaments that hold that joint together. Does that make sense? And the muscles now are going to get tight to prevent that from dislocating. Does that make sense? So the stability of your spine comes from the arch in your lower back, and driving a lot, positions, sitting, remove that curve from your spine, put you in a more destabilized position. You have an old injury wherein that you generally heal bent forward. We heal in school, we heal sitting, and we don't go back to the position we were supposed to be in, which is that arched position. Your lower back should be curved. The curve does a couple things. It keeps your middle back loose, and it allows the weight of your spine to be evenly distributed over all the segments. Does that make sense? Part of the reason why you're hurting is because all the work is being transferred to the bottom.
Okay.
You understand? So what I try to do is I try to work around the areas that hurt to take stress off the area that's been injured. I just noticed, I was looking at some of your other things, headache, jaw, heartburn. Those are all symptoms of the sitting also, in terms of when we sit, especially if we're heads forward, you understand, or our alignment. When the head goes forward, we get muscle stress in our neck. So your ear should be over your shoulder, and when your head goes forward, do you see how my muscles get tight? So that can cause inflammation in your upper neck, causes headache. When your head goes forward, your jaw gets jammed, so you get jaw pain.
Yes, but probably the jaw pain was for something that happened with tried to take off a teeth. The doctor put his weight on my jaw, and sometimes I talk. But what's something that
And then even heartburn. See, when we're bent forward, we sit. Our stomach is right underneath our sternum, and the position of our chest. My point is that your posture
it don't help.
Does a lot of this. Let me go have you stand up for me. I'm just gonna look at your posture. Go ahead.
About my knees, I born with this together.
Knees are coming together. Yep.
Yes.
Yep.
And I always walk in this way, that I put this together.
I got you.
And I try to get balance. Normally the people is a little more open here.
Right.
In my case, I do balance in this way.
I understand. You're pronated.
Exactly.
I got you. So, do you have any knee pain right now?
No, but I visited a doctor a long time ago, and he told me I have inflammation in the area.
Okay.
And he told me that I have the cartílago.
The meniscus
came back. It's the part that this is bone and bone, and the thing
the
that
meniscus.
you have.
Meniscus.
Okay. Yes, he told me that I have something go back, and for that reason I have bone to bone. And for the reason when I go through the stairs, I hear like a wiki.
It catches. Okay. Yeah, we'll check it out. All right. One finger. Where's the most discomfort in your lower back? Go ahead and turn around. Where's the most pain in your lower back?
This when
in the glute.
Yes.
More in the glute area or in the lower back?
It's here.
Kind of cross
and go to the glute.
Into the glute. Okay. Let me look at you from the side. You're fine. Look straight forward. There we go. So our head's about 1.5 inches, 2 inches forward. Your ear should be over, not by muscling it, but this is where it wants to be, because our world doesn't really guide us in how do we fix our posture. We, over time, slowly get more and more forward. And I joke with elderly people walking around, hunched forward. They don't do it because they think it looks cool. It's more comfortable. Do you understand? And it's a slow journey to becoming stuck forward. And so part of what I want you to do is we're going to loosen up the structures in the back so we can stretch you upright, and your lower back won't hurt if you're in the right alignment. Okay. The alignment has to be changed. In order to do that, we have to first sort of soften your spine. So been 15 years since you've been adjusted. The massages will help in terms of maybe some of the tissue isn't so dirty kind of idea. We'll massage a lot and we'll check it out. But the structures on the back have a lot of feeling, and that's why we desire to round forward, because it temporarily feels better to go forward. And what we can find is as I get you upright, hey Ed, it's more sore back here. I'm not sure if I like being.
Yes.
So.
And if I try to be in the correct position, it's painful for me.
Where the most? The neck or the back? Both?
In the back.
In the lower back?
Yes, in the back. For me, it looks like I'm walking weird.
Right. When you're coming upright, if you try to force yourself upright, what happens is this part of your back is not participating. You're just making your lower back do it. And remember how I showed you the hole gets bigger when you bend forward? It gets smaller when you bend back. And so you're pinching those nerves. All right, I'm going to have you on your back here for me. Take one deep breath in. Head back. Exhale. And then exhale. There you go. Good. Deep breath in. Exhale. Good. Deep breath in. I got you. One more. Exhale. Yeah. So, moving, but reluctant, right?
Okay, yes.
So, there's 12 vertebrae in there, and maybe 5 or 6 moved, but they didn't like me very much, right? So, tightness in here is going, so for every area that's working less, there must be an area that's working more. Okay. And that's why you're hurting down here. This area, I'm going to leave it alone, but if I did try to adjust it, I bet you it would all over the place, because you're hypermobile down here, and what we call hypomobile up here. Okay. Exhale. There we go. Yeah. The other side for me. You understand? The lower back is very willing to move. Exhale. Good. All right. Face up for me. Very good. There we go. All right. Left atlas. Right axis. All right. I got you. There we go. Let this go. I got you. Let it go. There you go. Yeah. Deep breath in. Let it go. There you go. Let it go. You're doing good. Chin up. There we go. Yay! You okay? I'll go deeper in a second. Just want to get you. Nobody's adjusted those bones in a while. So
I'm like an old car.
What is that?
Old car,
old
you know.
Car? Oh,
yes.
No.
When you feel like, oh my gosh.
Oh, we'll fix it. Right there. This is what causes headaches, inflammation up here, irritates the suboccipital nerves. So we want this area not to be sore, but the head being forward is what creates the soreness. So just rubbing it isn't enough. Lasering it isn't enough. electrical pads, most therapy, even adjustments is not enough, because the adjustment doesn't change the posture. I wish it were true. They did teach this for a long period of time, that you understand, adjusting the bones, clicking the bones will change your posture. Enough research was done to show that stretching is what makes your posture worse, bending forward for long periods of time, and therefore we must counter stretch and arch you back and then hold you there in order to change your position. And that is what we call correction, unlike therapy, which is just, something to do to help us, make us feel better for a little bit of time. Go real gentle. Here we go. Round 2. I'm waiting. Let it go. Exhale. There you go. Let it go. There you go. Yeah. Yeah. You did good. I know. Give that a second. Yeah. Okay. There we go. So this is the curve. I'll show you. Here we go. This is where your neck should be. All the time.
Wow.
Arched. I also noticed on your paperwork you mentioned sinus. The sinuses, ear, all of this drains down your neck. Does that make sense? And so a lot of sinus issues get resolved as we make your neck healthier, as I make your neck positioned properly.
Okay.
This all drains
better.
Do you have any pain inside here?
Not right now.
But sometimes you do have pain right in here?
I have swelling.
Right here?
Swelling,
right
yes.
Here? Okay. So this is the meniscus. It's a piece of cartilage very similar to the discs in your spine. It's a non-sensitive piece of cartilage. The tightness of the quad muscle attaches here on the tibia and squeezes this. So one of the first ways that I'm going to show you when you come up in a second, there's a stretch. If you can look down, you're trying to stretch the quad and that allows the meniscus to open up. Okay. And I'll show you in a minute, but working on the quad a little bit can relieve some of the, I got your leg, you're fine. You want, see how tender that is, Okay. But you understand this right here,
okay.
How tender is that? Pretty tender. Not too bad?
No, it's okay.
Okay. So, you get ticklish? Yeah, okay. But we have to start working on, you're too young to be wearing out your meniscus. Okay. We want to start rehydrating the meniscus by stretching the quad. Okay. Okay? Yeah.
I understand your point.
You understand? No difficulty.
I'm laughing. When I have
right.
pain, I'm laughing.
I also noticed on your paperwork you said tolerate pain, very, very high pain tolerance.
Yes.
I was like, okay, she's going to be a great one. Because I dish it out. Right there. Okay. For having all the weight on your toes, they are moving. It's a good sign. You're young enough. Sometimes if you have your weight here on the toes for too long, everything gets so jammed. Do you understand? Okay. So everybody's still moving. Hold on to the table as best you can. Maybe, there we go. I'm going to pull you this way a little bit. There you go. Good. Okay? You okay? What was that? I got you. Okay, I got you. What a difference your left and right side. Can you feel the difference? Mm-hmm. This left side is all big, sort of, I would say, tightness, let's call it. Right here, the right side is much lower, the left side much higher. Mm-hmm. What this does is the left side of your back is stiffer, and then another area has to compensate for that area being stiff. Generally, when the left is tight up here, the opposite lower takes extra stress. Okay. And so, and it can go to both sides, but right here, going to be spending some time, and probably when you get massages that they maybe, hopefully they're seeing the same thing, but right here is way too tight. Yeah.
They always tell me it's that.
Right, and so the table work is to make your spine supple, and then we can change this permanently through stretching. You don't have to live with this. I usually name them after old boyfriends, but you know, it's an old boyfriend, and so this is like somebody who still resides in here and needs to be evicted. This needs to be kicked out.
It's good to know.
Yeah, this is not something that we need to live with, and it. See,
I've been more than 10 years with
yes.
that.
I wouldn't be surprised if some of this is remnants of that injury when you fell. In a healthy spine, this area moves before the lower back. So when you're younger, does that make sense? This area is actually what sort of takes the force, and then because of it, quits. So 20 years ago, this area quit, and now for 20 years, you've been doing everything with your lower back.
Yes.
And we have to go into these areas and tell them, look, you can't stay quit. You have to come back and work with the rest of the team members. Right there. Very good. Yeah. Right there.
Oh. So painful.
I'm sorry.
But I understand.
It's terrible. It's
I
terrible.
understand.
It's terrible that we don't. We have no guidance. That it just builds up more and more, and we're not dealing with the
posture.
posture.
Worse and worse. Past the years and worse.
Right. It just grows.
Yes.
I know.
I call them the little monsters.
Little monsters. I like it.
And depending on the season of the year, sometimes it's more worse.
Yes.
Sometimes
Yes.
a little more relaxed.
Yes. I'm sorry. Yep. Not over there. I haven't even checked over here yet. Okay. Don't do it, Ed. Come on, let it go. Awesome. Let it go. Yeah, right there. Come on. Come on, let it go. Right there. I know. Wow. All right. Yeah, right there. Yeah, these ribs are more inflamed than I thought they were going to be. Right there. Yeah. Very good. I know, I got you. Get her neck right there a little bit. This is the headaches right here. I got you. I know. It's coming out. I'm not gonna go too crazy, but we gotta start getting some blood in there. Does that make sense? A lot of the area is so filled with lactic acid, there's no oxygen to remove the lactic acid. So by bringing the blood in there, we start converting that lactic acid to carbon dioxide and water, and then that cleans the tissue, makes the tissue less acidic, makes the nerves a lot happier. Doing great. I got you. Yep, right there. Yeah, real quick, it comes out right there, right on that upper neck. Doing great. Just gonna get like the first layer. There it is. Right there. Right there's the word. I know, yeah. Okay. All right, it's good, it's good. Okay. I'm not going that hard. This is really just, that makes sense? It's just the combing draws a lot of blood into the area, and that binds to anything that's in here that it directly correlates with what you feel. And as a patient goes through my care, I'll be able to comb you and nothing happens. This is to detract from people that say, he's just injuring you. And it's like, well, what after this is clear, does that make sense? There won't be any marks. You shouldn't be able to make a mark. It's from things being stagnant. And then it'll directly correlate with soreness. So as I work on your back, there won't be any soreness, and likewise, there won't be any mark. So I want you to try to come down onto your bottom, into your heel. There you go. Is it okay? Yeah. You have to work on this. Up. Do you feel it stretching much, or is it too easy?
No, it's stretching.
Okay. Yeah. Enough? Ha! It's enough, Ed. Don't give me any more. Because if it's too easy, I have other ways of making it harder. She knows. She knows too well. Okay, so the first step is with the foot over the edge. You understand? And you come down, and you're trying to get your bottom to your heel. About a set of 10 times.
Okay.
And the second step is you actually have your foot on pointed, not over the edge, and then you come down inside of the heel as best you can. You understand? A little more difficult. Yes. Correct. And hold on to the table if you want. Hold on to the table.
Okay.
You're not trying. Sometimes you can go up and down like this, but you're trying to come up, and you got to stretch that quad. The next part, you'd have to be sort of on the floor, but you You understand? You actually start laying back.
I will try.
But you understand that's the progression that we're trying to do.
Okay.
There we go. There we go. Good. Arms up. Yes. So you understand? Make it easy.
Mm-hmm.
Don't overwhelm yourself. Head back. There you go. It's not too bad.
No.
It's okay. All right. It's just good. Keep the knees bent. All right. Good. And right there. Perfect. You got it. She's tough. You're good. Okay. Stay there. So I don't want this going all the way down the bottom. So we only stay
In the middle of the back.
here.
Okay, here and the
here.
middle. Okay.
So not down here. Remember, this is already too loose.
Okay.
So we don't want to put it in the
In the-
lower
in
back,
the- okay.
middle back, upper back.
Perfect.
Head back. Let's try. And bend your knees a little bit more. Okay, let me try. Test you. Knees left. Stretch. Okay.
And do the same
Yes.
thing.
Then knees right. There you go. Respira. There you go. It's okay. So we use the adjustment
Okay.
as a way to make your spine limber so that you can do this at home every day.
Okay.
I think of the roller as like a toothbrush.
Okay.
You understand? And if you don't brush your teeth the next day, smell. You understand? We use the roller to keep your spine clean. It's a counter stretch. So all your work is forward, sitting, driving. You understand?
Mhm.
We have to, at the end of your day,
Relax. Mm-hmm.
and the goal is 20 minutes.